two pandemics. There is COVID-19 and then another one that started hundreds of years ago. And I'm talking about the pandemic of racism and inequality in this country. The events of the past week or so have shown starkly how much pain has built up in this country. There is a long list of Black people who have been killed during the struggle, including my very own grandfather, J.C. James, who was murdered on July 4th, 1956 in Seneca, South Carolina at the hands of a sheriff's deputy. And so we grieve today not just for George Floyd, not just for Emmett Till, but also for the J.C. Jameses of our country. The truth is, and I've had some time to ponder this and have had conversations with tons of friends and family members, and I have come to the conclusion that for African Americans, having a negative interaction with the police is like a bee sting. Almost all of us have either had one in our lifetime or we know someone who's had one in their lifetime. And so the protests and rallies and outrage that we see all across our country and is also joined in other countries, we know now that as society and as a nation, it is time for us to reimagine the relationship that we have between African Americans and the police. We must also reimagine the liberties and freedoms of Black people that have been cut short and denied in a country that we and our ancestors helped to build. We belong here, and Black lives matter. Now, I understand that the conversation that we must have is going to be a contentious one. It is not easy. And I'm also acutely aware that change is never easy. I have spent the better part of my 23 years working in this county on one side of justice. And I can tell you that in my current position, we will continue that work with even more fervor to continue to have the hard work of developing reforms that this moment in history requires. I believe that we have the ability to walk and chew gum. It is not an either-or proposition. I believe that the reforms that are necessary can be accomplished, and I believe that we also have the ability to emphasize that we have a right to be safe in our community from thieves, from domestic abusers, sexual predators, murderers, and the like. This likewise is, for us, a civil rights issue. To be safe in your community is a civil rights issue. I understand that this conversation will take time and patience, and that the reforms we choose won't satisfy everybody, and again, won't be easy to accomplish. But I also must say to you that if we leave this moment, and the only conversation we have is about African Americans and the police, we will have missed it. If we ignore the other injustices that occur every day that have systemically denied our children access to equal education, our community access to quality health care and food options, access to preventative care that could have spared lives during this coronavirus pandemic, if we ignore those things, we will have certainly missed the moment to really have the kind of changes that are necessary to change the very fabric of America. We must come together in order to do this and to implement the reforms that are necessary to prevent any more senseless violence and grief. Now, as we go forward, I have to tell you, I'm going to use a word that may sound crazy to some, but I am so excited to imagine a brighter future for our children. And if we do this right, our children will certainly grow up in a world that is much better than the one I experienced, is stronger and more just than the ones that my parents and grandparents experienced. And so the question is not whether we should make that future a reality, it's just how. How do we make it a reality? I'm working on the answer to that question, and in the next days and weeks, we will announce new reforms that we believe will make the future brighter and will make this a reality. Now, I want to turn my attention back to COVID-19, which, by the way, is not disconnected. I mentioned to you just a moment ago the disparities and the inequalities that we've seen. And COVID-19 is one, I think, that has surely ripped the Band-Aid off of it and helped us to see some of those inequalities. And so first off, I want to thank Prince Georgians who made sacrifices, who listened to us, who went into their homes, who social distanced, many of whom were laid off and lost their jobs and their businesses suffered. So I want to thank those individuals. Because of their hard work, we are, thank goodness, moving into phase 2 of reopening. I would be remiss if I also didn't take a moment to thank not only Dr. Carter and the health department and the men and women who have worked tirelessly to make sure that things were safe for us, but I'd like to thank all of our frontline workers, police officers, and firefighters. I want to give a big thanks for those who are in our hospitals to this moment. So even as we begin to move on into phase 2, I don't forget the fact that there's still a mother, father, sister, brother who are working to save lives, putting their own lives at risk. And I want to just continue to thank those people who are still very much in the midst of this fight. It's not over yet. Now, when we look at our case numbers, our peak was the week of April 26th, when we saw 2,370 new cases. Since then, we have continued to see a decline. Our most recent data from last week, starting May 30th, shows that we had 1,432 new cases. The rate of death from COVID-19 is going down. The week of April 26th, we had over 70 residents per week who were dying from COVID-19. The rate of death has continued to drop. For the week of May 30th, there were 50 total deaths with an average of 7.1 deaths per day, a slight decrease from the previous week of 7.6. And I think it is worth saying that that is still way too high. 7 deaths per day. As we look at our hospitalizations on May 9th, we had 262 COVID-positive patients in our hospital. We've seen a decrease since then, and we have stayed below 150 patients since June 1st. And finally, despite the fact that we have surpassed testing of 10,000 residents per week, our positivity rate is at a record low. We saw our high at 43.1% the week of April 19th, and last week our positivity rate was at 14.1%, which was a 5% drop from the previous week of 19. I think Dr. Carter will tell you that we are now, I think, close to 11%, and so we are doing much better. In Prince George's County, phase 2 will include the following. Retail stores will be open to in-store with safeguards and capacity limits. That means that we can open up inside those retail spaces now, 5 people per 1,000 square feet, and this will be allowed, but not to exceed 50% capacity. Barbershops and hair salons will be allowed to open for hair services by appointment only at 50% capacity with the use of PPE. This includes those face masks, gloves for all employees, and customers must also wear masks, along with appropriate floor coverings to create adequate social distancing. All other personal services, which includes nail salons, massage and spas, can now reopen by appointment with strong safeguards and physical distancing in place. These businesses must have PPE, including face coverings and gloves, and they must only have 1 customer per 200 square feet of service delivery space. Customers are required to wear the facial coverings, and high contact surfaces must be cleaned with disinfectant every 2 hours. Restaurants may open with both outside seating and they may have indoor dining at 50% capacity as allowed by the state of Maryland. There can be no more than 6 people seated at a table, and tables must be at least 6 feet apart, and no more than 50 people will be allowed at any outdoor restaurant establishment regardless of space. Employees must receive health screenings prior to their shifts, and all CDC guidelines must be adhered to. Additionally, all employees must wear facial coverings, and restaurants must have hand sanitizer and appropriate hand washing facilities available. Houses of worship can open for gatherings not to exceed 25% capacity. Otherwise, they can maintain online services, drive-in services, and outdoor services of 250 people or less, as long as they maintain appropriate social distancing. Child care facilities will be able to open for essential employees and for employees who are returning to work in phase 2. Youth sports may now resume in small groups of no more than 9 children and 1 coach. There can be no more than 50 people in any one area. Outdoor community pools, both public and private, may open. These facilities may only operate, however, at 25% capacity and must practice social distancing guidelines. indoor pools will remain closed. Gyms, fitness centers, and other indoor physical activities will remain closed during phase 2. Parks are open for personal fitness and fitness classes. This includes all parks, fields, tennis courts, tracks, and golf courses. Low-contact sports will be allowed as well. Car washes may open with automated systems, but drivers and passengers must stay inside of the vehicle at all times. Workers may wipe down the exterior of the car, and self-service car cleaning is allowed. County government will return a limited number of employees, increasing some additional services. However, we are encouraging employees to continue teleworking. And now there will be a complete listing of my order, and the new non-essential businesses allowed to reopen will be on our website, mypgc.us. Moving into phase 2, I have to tell you, is exciting. We must all do our part to continue to be safe, and we're cautious as well. Dr. Carter is going to come up right behind me, and I can tell you, without even looking over there, that his heart is beating out of his chest with me announcing these. So please, to every Prince Georgian and to everyone who is listening, please know that COVID-19 is still very much a part of our community. We will not be able to return to the way that things were. We're asking you to continue to be safe, and to continue practicing social distancing. Please continue to wear your face mask. We are not out of the woods, although things have improved. I know that businesses across Prince George's County are hurting as a result of COVID-19. This has been a terrible and very, very difficult time. But as I have said before, while we may not be inside of our office buildings, I want you to know that your government continues to work hard for you. And although many of our businesses were forced to close their doors, we are slowly reopening, and development continues to move forward. We will rebuild and restore. And as I said to you before, it is our mission to make sure that we do so in a way that makes us stronger than ever before. There are so many exciting projects that we have that still continue today in Prince George's County. The recently approved developer for Beacon Heights Development Project. We've just approved a number of community impact grants this week. We've approved new work at the Amore Apollo project in Largo, and in downtown College Park, a mixed-use residential development project by Bizzuto Development and their partners is underway. So I have to tell you that I am so humbled by this community. You all continue to amaze me. I am so inspired by all of our Prince Georgians who, as you all know, I love so very much. This year has been a trial, but through COVID, we've hung together, we have prayed together, we have worked together, following the advice of experts to help us protect the lives of our family members, our friends, our colleagues, and our residents. I am also humbled by the men and women who have joined me over the last week in prayer and protest as we mourn the loss of George Floyd, Breonna Taylor, and too many other Black people who have lost their lives to senseless violence. I have watched Prince George's County yet again, and I've been here nearly 50 years, but it has transformed before my very eyes over the course of my lifetime. I work to make this a better place because time and time again, I look out and I see Prince Georgians doing the exact same thing. Nobody works harder, is more dedicated or committed than Prince Georgians, and it is such an honor to represent you every day. 2020 has been a trial, but I know that whatever light lays ahead, our residents are ready. We can get through it together. Thank you so much, and at this time, I'd like to welcome to the podium Dr. Carter.
Thank you, Madam County Exec. It is an honor to serve Prince George's County. Good morning. I'm pleased to report our numbers across the board show Prince George's County is ready to move to phase 2 of our reopening journey. We are continuing to reduce our curve. New COVID cases per week are going down. We've seen a 27% drop in new cases from the week prior, landing at just over 1,400 cases. Now consider where we were in the last week of April. We had roughly 2,400 new cases a week. a difference of 1,000 cases a week. That is great progress. We continue to mourn the loss of every Prince Georgian who has passed away from COVID-19. We've seen a steady reduction in how many residents per week die from COVID. Looking back to the third week of April, we had about 74 residents who died. That was our peak. Since then, the number of deaths have dropped to about a third, dropped by about a third. In the last week of May, about 50 of our community members died of COVID. And although this is an improvement, we will not rest until this is reduced even further. There's still a steady decrease in the number of COVID hospitalizations in our county. Right now, our 4 hospital systems have 128 inpatients with COVID. Just 2 weeks ago, there was 181. As the county executive mentioned, we have managed to stay below 150 hospitalizations due to COVID within the county for at least 9 days. As the number of people hospitalized with COVID decreases, our hospital capacity keeps increases, and that's an excellent sign for us. Additional ICU structures at Fort Washington Medical Center became operational in June, and more are being built as we speak and are expected to be ready in the coming weeks. We need to keep our hospital capacity robust as we move into phase 2, especially as the hospitals start to do more procedures such as surgeries, and they'll start to consume our county hospitals. So we have to keep a close eye on this. And as we plan for any increases in COVID, we want to be sure we have the capacity for the rest of the year. Another reopening measure we track is testing. How many people are we testing? As of the last week in May, more than 10,000 people were tested for COVID-19 in Prince George's County, exceeding our original reopening goal of 9,000 per week. Expanding the number of Prince Georgians who get tested gives us a better sense of how the virus is behaving and spreading in our community. This means we can track who needs to be isolated to prevent further spread. This week, the health department opened our second testing site. This is at Rolling Crest Chillum Recreational Center in Langley Park, in the Langley Park area. Our tests are free to the public. They are by appointment only. Please call 301-883-6627 to make an appointment in Langley Park or at the Cheverly Health Center site. We plan to fully open a third testing site in Laurel on Monday. Our COVID positivity rate keeps going down. That's very good news. This is in large part a reflection of our residents seeking tests from all sources, including our testing sites. And we're encouraging this. This is very important. It is now about 11%. That's outstanding given the fact that it was more than 40% at one point in April. One last thing about testing, we want you to get tested if you attended or plan to attend a mass protest. Even if you do all the right things to protect yourself during these important events, large gatherings pose a high risk of transmission. I am so grateful for our brave hospital and healthcare workers, as well as the residents of Prince George's County for diligently following the guidance. You all have all helped us get to this point in the COVID fight, and I, like the county executive, are so proud of you. We have to stay strong. We've got to stay smart. We must continue to stay 6 feet from each other in public. You still have to wear a mask covering at the store, on public transportation, or when you're coming in close contact with individuals other than your family members. Please continue to wash your hands, clean your hands, stay at home as much as possible. We are still safer at home. We are winning this battle. Prince George's County is winning this battle, but we have to stay disciplined to continue to get across the finish line. Thank you very much.
Okay, so I was told that I forgot to mention the most important part of this, and that is that this order takes effect on Monday, June 15th. So for those who had already pulled out their swim trunks and were headed out to the pool areas and headed to their favorite restaurants, planning to get there tomorrow, please don't until Monday. I have to tell you, my own father, I was on the phone with my mom last night, and she said, oh, I have a note here from your father that he just slid me, wants to know whether he can go to the pool hall yet. So, Dad, not yet. We'll not until next week, please. So I forgot to say that it does not go into effect today. We have to wait until Monday.
And we'll take any questions.
Oh my goodness. So Tracy, you've clearly spoken to my team. I'm going to be tested today at 4 p.m. And I recommend that every Prince Georgian and anyone else who participated in any of the protests I did last weekend participate along with a number of others at the National Harbor. And so I will be tested today at 4 p.m. and I do recommend that everyone else who participated in any of those marches or protests and were in close quarters that way should please be tested.
And do you need to have an appointment?
Oh, I'm sorry. No, you do?
Yeah.
I'm sorry, yes, you do need to have an appointment.
Can we talk about why there's a need for an appointment? Is this because of limited test availability?
No, it's not from limited test availability. It's because of our workflow at this time. Now, as it will become a time when you will not need an appointment. But right now, as we ramp our sites up, there's a certain workflow you have to have in order to be sure that everybody gets tested. The only thing I'll also say about that, even though you see some places that have a lot of tests, on the back end, they have to do all the reporting. And sometimes folks don't get their reporting time, et cetera. We want to be sure we control that and make sure we can test everybody. So we will get you an appointment. We will get you in. And as our sites increase, we will be sure we can serve every Prince Georgian.
Next question?
So, you know what, I understand the spirit of what was suggested. The spirit was that we want to make sure that we align all of our resources to our priorities. But my position is this. I believe that we cannot afford to withdraw a single resource from our students. It's both and. It is that they deserve to be in a place where they are safe, and they deserve to have the mental health services and every other service that they deserve. At a time where we are in those schools because of the law. We are there because of Maryland state law, the Safer to Learn Act in 2018 that requires adequate security in our schools. And so our police officers are there. There was a misunderstanding because it does not cost us a single penny more to have police officers in those schools. They are there as a part of our community policing program. But I believe that at a time when we have seen mass shootings at a time greater than any point in history, that our children need and deserve, our teachers, our administrators, and every other person in those school buildings deserve as much as we can offer them and not as little. But I do understand the spirit of it, and so I can hear it. Then why don't we make sure we also focus on mental health services for our young people? We want to make sure that our children have the ability to have mentoring, to have every resource they need to be whole and complete people. I can hear that, and I agree with those sentiments, and I will continue to work to make sure that we have those resources available. We have increased even in this year's budget the amount that we spend on psychologists. We are standing up school-based health clinics. We are providing for our students, again, free dental care and vision care. And so in my mind, we don't withdraw resources from our students. They deserve both and to be safe and secure and to have those other services that are suggested. But I understand the spirit of it. And at this time, when everybody's just trying to come up with the best solutions, I think we should be open to hear what people suggest. But I don't believe that withdrawing school resource officers would be in the best interest of our students, their teachers, their administrators, and others in those buildings who deserve to be safe and to feel safe.
Protesters have been calling for defunding the police and moving some money from police budget and putting it
So again, I think it's intelligent to hear whatever reforms are suggested, and I don't disagree that, again, all of our spending ought to align not only with our values, but with the needs, and our needs every day are changing. And so to realign some of the spending that we have to make sure that we're also funding health departments at the level that they deserve to be funded, that our health and human resources are funded, those are things that we too are looking at. But what I have said before, and I will say once again, is feeling safe and being safe is likewise a civil rights issue. And I would never do anything that would compromise the health, safety, and well-being of our citizens. It's both and, that we must find a way with the dollars that we have to fund both. And I don't disagree with some who say, you know what, why don't we look at these budgets and just see whether there are spaces where we might realign dollars, reallocate dollars to health and human services, to the health department. We will be looking at that as well.
Prince George's County will come on resident safe with the phases, and do you think now, looking at the numbers and the testing and what's happening in hospitals, that the county is moving closer to being able to catch up to the rest of the state before the next year?
You know, we're going to take our time. We're not in any hurry, really, to send people into a situation where they will get ill again and die. What we just went through has been so traumatic for all of us. You know, we can't forget that there are people, even when we move forward with COVID, who can never go on in the way that they were, who lost loved ones, who not only died, but who now have health conditions that will continue. So we'll continue to listen to Dr. Carter, and we'll follow the numbers. And so if it means that we continue to lag behind the state ever so slightly, but it saves lives, we're going to do that. And as he has mentioned, we're really doing very well. So we're really thrilled. I have to tell you, I am excited beyond belief that we now can see some of our businesses reopen and see our citizens able to go on and to do some of the things they enjoy, but it's not worth our lives. It's not, and so we're going to be really cautious as we go forward. And if the state is a little ahead of us, so be it. Our lives are just that important.
Some areas that have reopened have seen a spike because people who have not been following social distancing guidelines, wearing masks, the rest of it. What are your words, Ms. Georgia,
So
as they move into phase two?
it's such a good point that you raised, that as we look around the country, there are some cautionary tales about the danger and the risks involved with going too quickly, that there are areas now that are seeing some resurgence of cases, that people are sicker than ever, and those people are messaging back to us, don't make the mistakes that we made. And so we have some benefit to some extent in that we can watch examples across the country as to how things turned out for those who opened at certain phases, and we really are in a really lucky position in that we can look at them and adjust to make sure that hopefully we don't experience a resurgence. And so again, I say to Prince Georgians, we are going to use the advice of our healthcare professionals and scientists. It is my job to protect your life and your livelihood, and we won't make a single step until the doctors and scientists tell us that it's safe to do so. But we're getting there. And, you know, and we're going to continue to get there. But we just have to make sure that people don't get sicker and die because of it.
Okay, and with nothing else, I want to say this before we end. For everybody, particularly those who participated in protests, who were seeking information on how to get an appointment at one of our sites, that number is 301-883-6627, 301-883-6627. That's the phone number for our coronavirus hotline. That's how you'll be able to get an appointment. Thank you all so much.